Good morning, I'm Kristen Barton. Here's what we're following on this Sunday. Healthcare workers are speaking up across the state, raising concerns over new public safety guidelines. On Saturday, the State Department of Public Health declaring all healthcare workers who test positive for COVID and show no symptoms may go back to work immediately without isolation and without testing. Healthcare workers who were exposed and show no symptoms of the virus may also return to work immediately without quarantine and testing, but they must wear an N95 mask. The rules go in place starting now through February 1st.
In order for us to be able to take care of our patients, we need to be in the best of health. And so going to work, sick, very well knowing that we have the virus, will not be a good fit for our patients.
Now, in response to this new order, the state's public health department said, quote, due to critical staffing shortages currently being experienced across the healthcare system because of the Omicron variant, the California Department of Public Health is temporarily adjusting return to work criteria, end quote. Thousands of people who have had COVID-19 have at least temporarily lost their senses of taste and smell. But for some, instead of losing those senses, the disease makes everything they smell or eat disgusting. Ty Hunter tested positive for COVID-19 on Christmas Day 2020 and lost his sense of taste and smell. In late March, they came back, but a few weeks later, something changed. It's a phenomenon called parosomia. Ty says that since then, about 90% of all foods have the taste of rotten flesh mixed with chemicals. But it's not just foods, it's soaps, perfumes, colognes, shampoos, almost anything with a smell.
I know that I'm not speaking alone with people with parosmia. If I could go back and lose my taste of smell and taste it, I would do it in a heartbeat. I love peanut butter and it's terrible.
There are 2 private parosomia post-COVID support groups on Facebook, each with around 40,000 members. One study indicates the condition typically lasts an average of 3 months, but can linger as long as 6 months. Fully vaccinated people do not have to wait as long to get their Moderna booster shot. Friday, the FDA amended its emergency use authorization for the COVID-19 vaccine. It says those at least 18 years old can receive a booster dose 5 months after their second vaccination. They used to wait at least 6 months. Healthcare officials have been promoting vaccines and boosters as a way to combat the recent uptick in cases of the Omicron COVID-19 variant. The FDA already shortened the time between doses of the Pfizer vaccine. And now look at your weather forecast here. We are having warmer temperatures, as you can see, across Kern County, especially here in Bakersfield. I mean, it's a little cold at 8 a.m., but it will snake up to 65 at 2 p.m. That'll be really nice for your Sunday following brunch to go on a walk, maybe at the Parkett River Walk or somewhere else that is your favorite hiking spot. It will cool down a little bit, but not too much by the evening hours, so it'll go down to 56 there. Now looking at your weather forecast highs, we're having 65 in Bakersfield, and then across the county, we are having those warmer temperatures. 66 in Arvin. In our desert communities, we have higher 50s. It's always a little cooler there. And then in our mountain communities, lower 50s as well. Now we do have some wind gusts coming our way, but that's really all the time we have here on 23 ABC News, and we'll have more for you later on in the day.